Well, more COVID-19 cases have been confirmed in the White House since President Donald Trump's been in hospital. The U.S. president was taken to hospital yesterday, barely 24 hours after the news broke about his test results. Our U.S. correspondent Simon Marks joins us live now from Washington. Simon, thanks for joining us this evening. I believe there is some breaking news for us.
Yeah, I must tell you, Faith, we're dealing with a very, very confusing situation here in Washington, D.C. About 90 minutes ago, the president's physician briefed reporters at Walter Reed Medical Center, where the president, of course, was transported last night for treatment for COVID-19, and essentially assured the public everything was fine. The president was doing really well. He was responding fantastically to treatment. He'd been walking around his rooms and saying that he was feeling so good, he felt he could go back to the White House maybe even later today. That was the president's phrase, not the doctor's phrase. However, there was some confusion in the way in which the White House physician claimed that the president had initially been diagnosed with COVID-19 72 hours ago, because that certainly wasn't anyone's understanding here. We all thought this all started taking place on Thursday night, not on Wednesday. So there's a huge question about the timeline. But beyond that, we're also now being told by a senior White House official, and this is coming from the pool of reporters that is attached to the president on a daily basis, that the president's vital signs over the last 24 hours were very concerning, and the next 48 hours will be critical in terms of his care. We are still not on a clear path to a full recovery. And while the White House pool is not identifying that senior source, I can tell you that there is videotape of the White House Chief of Staff talking to reporters and requesting that the cameras that were rolling at the time be turned off before he started imparting information. So either the doctor has not been completely clear and honest and direct with the public about what's taking place in that presidential suite at Walter Reed Medical Hospital, or this unnamed senior source within the president's inner circle is not being entirely honest about what's taking place, although his comments have been provided to reporters off the record and off camera. What we do know is that all of these briefings today have only added more questions to what the White House knew of the president's COVID-19 status, when they knew it, and why exactly he was permitted on Thursday night to attend a fundraising event in New Jersey, when by then it is now absolutely apparent the White House was, if not aware that he was COVID-19 positive, certainly very suspicious about his COVID-19 status. So this situation moving very rapidly here this afternoon, and none of it is good news for the president or for his re-election campaign.
I mean, Simon, we speak about questions being added to a pot. Let me add another question to this mix, because he traveled to and from 3 states, right, during this course. How many people did he come into contact with? That is a major question. How many people did he expose or potentially expose the virus to during this period of time? Because that says something really about the bigger issue here around contact tracing and the people that really need to self-isolate or quarantine during this time.
Absolutely. And I can tell you that I was just texting back and forth with a public health official who works in one of the senior public health offices of the land, who was saying that now a substantial track and trace operation needs to get underway to figure out exactly where the president has been over the last week and who the president has been mixing with. And that official was suggesting to me that Joe Biden, the Democratic presidential candidate, should be taking a daily COVID-19 test now for at least the next 5 days, given that he and his family were in the immediate proximity of President Trump and his family at that disastrous debate on Tuesday night in Cleveland, where, by the way, we already know 11 people involved in the planning and setup of that debate have tested positive. I mean, it is possible that Donald Trump has, over the last week, acted himself as something of a super spreader for COVID-19, given that we know that the event that took place there at the White House exactly 1 week ago when he unveiled his Supreme Court nominee to the public. Open-air event, at least 100 people there, no one wearing face masks, everybody gathering in close proximity like it was a late summer garden party. We know of at least 7 people at that event, including 3 Republican senators who have now tested positive for COVID-19, and the president's former senior strategist, Kellyanne Conway, a woman who earlier in the year scoffed at the notion that the Trump administration was failing to contain COVID-19. Then he went to Cleveland for the debate, then he went to Minnesota for a rally, then he went to New Jersey for a fundraiser, and it's perfectly possible that he and people within his inner circle have been spreading COVID-19 all over the country wherever they have travelled. It's an absolutely astonishing situation that is completely redolent, Faith, of the claims that President Trump's detractors make, that he's been utterly reckless with regard to this public health emergency that the country has been facing all the way back until February.
Now, as we build up to November, the assignment, does that mean it's officially, in tennis terms, advantage to Joe Biden?
You know, I think it is very difficult to know where all this heads. I mean, on the political face of things, you would have to say that if you're a Democrat running for the president right now, your ability to make the case that President Trump hasn't just been reckless with his own health and the health of his own family and staff and people inside the White House, he's been reckless with your health, the health of the American people. So clearly, in rhetorical terms, this assists Joe Biden, provided he can find the language necessary simultaneously to convey that he wants the president to make a full recovery and that he continues to send prayers and thoughts in the direction of the White House. The flip side of that coin is that it's possible that certainly among President Trump's supporters and undecided voters, there might be a wellspring of sympathy for the president who could emerge from all of this saying, I really didn't realise how awful this was. I'm now going to start taking this much more seriously than I ever did before. I mean, I tend to think that the advantage goes to the Democrats as a result of all of this. But, you know, we're in uncharted terrain here, and we are 1 month today away from America's presidential election. The hour is very late for all this to be happening.